Hey people, it's Niles talking. This is from the New York Times. The United States CDC tells states to prep for COVID-19 vaccine distribution as soon as late October. The U.S. Center for Disease Control and Prevention has asked state public health officials to prepare to distribute a potential coronavirus vaccine to high-risk groups as soon as late October, documents published by the agency showed on Wednesday. The timing of a vaccine has taken on political importance as U.S. President Donald Trump seeks re-election in November after committing billions of federal dollars to develop a vaccine to prevent COVID-19, which has killed more than 180,000 Americans. That is false, because according to statistics released by the CDC themselves, they found that less than 10,000 actually died from COVID alone. Most of those people died from a list of other things such as heart disease, accidents, or other illnesses like diabetes. Only a small group of them actually died from just contracting COVID by itself. Let's keep going. For the purpose of initial planning, CDC provides states with certain planning assumptions as they work on state-specific plans for vaccine distribution, including possibly having limited quantities of vaccines in October and November, a CDC spokeswoman told Reuters. The New York Times had earlier reported the CDC had contacted officials in all 50 states and 5 large cities with the planning information. The country's top infectious disease expert Anthony Fauci earlier on Wednesday said on MSNBC that based on the patient enrollment rate in COVID-19 vaccine trials underway, there could be enough clinical data to know by November or December that one of the vaccines is safe and effective. The vaccine will be made available free of cost, first to high-risk groups including healthcare workers, national security personnel, and nursing home residents and staff, the agency said in the documents. Regulators around the world have repeatedly said development speed will not compromise vaccine safety, as quicker results would stem from conducting parallel trials are usually done in sequence. But such reassurances have not convinced everyone. Again, how can you have a proper trial? Don't medical trials for just normal drugs take years? How can you possibly test something and know of its effects? What are the effects of something 5 or 10 years down the line? But you've developed this, the outbreak happened in March or February, and you have a vaccine by October. That is, even by just common sense standards, not extremely dangerous and taking a lot of risks with people's health. Let's keep going. Preliminary results of a survey conducted over the last 3 months in 19 countries show that only about 70% of British and US respondents would take a COVID-19 vaccine if available. Scott Ratson, co-leader of a group called Business Partners to Convince, told Reuters in August, drug developers including Moderna Incorporated, AstraZeneca plc, and Pfizer are leading the race to develop a safe and effective vaccine for the respiratory illness. The CDC documents describe 2 vaccine candidates that must be stored at temperatures of -70 and -20 degrees Celsius. These storage requirements match profiles of candidates from Pfizer and Moderna. Last month, the U.S. Health Department said the CDC was executing an existing contract option with McKesson Corp to support potential vaccine distribution. CDC Director Robert Redfield has asked state governors to expedite McKesson's request for building vaccine distribution centers and to consider waiving requirements that will stop them becoming fully operational by November 1st, according to a recent letter obtained by Reuters. Reporting by Najna Madipatla in Bengaluru and Dina Beasley in Los Angeles, editing by... Oh, that's not important. I'll just leave the article and you can read that for yourself. Please comment, rate, share, and subscribe. Peace.